The second leading cause of death in America is cancer, and of that, colon cancer is about 10% of those deaths. Dr. Scott Gering of Desert Regional Medical Center in Palm Springs talks about the diagnosis and treatments for colon cancer.
The lifetime risk of colon cancer in the general population is about 6%. So if you're just a general run-of-the-mill guy with average risk, it's about 6% chance in your lifetime you'll end up with colorectal cancer. There are risk factors for colon cancer. The big ones are familial history of colon cancer. So if you have primarily first-degree relatives, but any significant relatives that have colon cancer, you're at increased risks. Other risk factors for colon cancer are genetic syndromes. There are several genetic syndromes that are well known to cause colon cancer. Familial adenomatous polyposis is one of them. That's a 100% chance you'll get colon cancer in your lifetime. And so those people are very high risk, and it's a genetic-based disease. Similarly, hereditary non-polyposis colon cancer is a second genetic syndrome that causes, known to cause increased risk of colon cancer. And then the third one is inflammatory bowel disease. If you have inflammation in the colon long term, that's Crohn's or ulcerative colitis, that increases your risk of colon cancer significantly. The older you get, the higher the risk of colon cancer. We start our screening at age 50 because most colon cancers happen after the age of 50, usually about 10 years after the age of 50. So age 60 is the typical age a colon cancer will show up. So we like to start screening in the average age person about 10 years earlier than that. We understand, as far as we can tell, colon cancers come mostly from polyps. Polyps progress into colon cancers. So if you take the polyps out early, you can avoid the cancer completely. So that's the best reason to screen, is we can prevent the cancer, really. Colon cancer is essentially, for most people, is a preventable disease if we take the polyps out early. Colon cancer is a surgical disease, period. I mean, there's no other question. To cure colon cancer, you need to cut that segment of colon out, and with clear margins. It's that simple. But to cut it out, you need to find it first. New on the horizon as far as screening for colorectal cancer, there's a couple new things that are currently being developed. One includes virtual colonoscopy. There's been a lot of publicity about virtual colonoscopy, which is either a CT scan or an MRI scan instead of putting a scope in the bottom. That allows essentially a virtual picture instead of putting a camera inside. Some of the other tests that are, again, non-invasive tests that are on the horizon, there are new stool tests that will check for DNA, genetic defects in the stool samples that will indicate that there's potentially a colon cancer that would initiate screening in the appropriate person. Stage 1 and 2 colon cancer, it's localized to the colon, it has not left the colon. This 5-year survival rate across the board is 90 to 95% 5-year survival rate. So you essentially can cure those cancers. Once the cancer leaves the colon, goes to the lymph nodes or spreads beyond the lymph nodes, the cat's out of the bag, as we say, and the survival drops dramatically after that point.